Case report. Resolution of malignant canine mast cell tumor using ketogenic metabolic therapy alone. Scientific paper by Thomas N. Seyfried, Purna Mukherjee, Derek Lee, Lin Ta and Lauren Nations. Background. Mast cell tumors, MCT, are common neoplasms in dogs and are similar to most other malignant cancers in requiring glucose for growth, regardless of histological grade. Ketogenic metabolic therapy, KMT, is emerging as a non-toxic nutritional intervention for cancer management in animals and humans alike. We report the case of a 7-year-old pit bull terrier that presented in 2011 with a cutaneous mast cell tumor under the right nostril. Methods. The patient's parent refused standard of care, SOC, and steroid medication after initial tumor diagnosis, due to the unacceptable adverse effects of these treatments. Following tumor diagnosis, the patient's diet was switched from normal dog food, brand, Ol Roy, to a raw vegetable diet with cooked fish. The tumor continued to grow on this diet until July 2013. Then, the diet was switched to a carbohydrate-free, calorie-restricted ketogenic diet, consisting mostly of raw chicken and oils. A dog food calculator was used to reduce calories to 60% of the energy consumed on the original diet, meaning a 40% calorie restriction. A total of 444 kilocalories were given twice per day at 12-hour intervals, with one medium-sized raw radish given as a treat between each meal. Results. The tumor grew to about 3 to 4 centimeters and invaded surrounding tissues, while the patient was on the raw vegetable cooked fish diet. The tumor gradually disappeared over a period of several months when the patient was switched to the carbohydrate-free, calorie-restricted ketogenic diet. The patient lost 2.5 kilograms during the course of the calorie restriction and maintained an attentive and active behavior. The patient passed away without pain on June 4, 2019, age 15 years, from failure to thrive due to an enlarged heart with no evidence of mast cell tumor recurrence. Conclusion. This is the first report of a malignant cutaneous mast cell tumor in a dog, treated with ketogenic therapy alone. The resolution of the tumor in this canine patient could have been due to the diet-induced energy stress and the restriction of glucose-driven aerobic fermentation that is essential for the growth of most malignant tumors. Further studies are needed to determine if this non-toxic dietary therapeutic strategy could be effective in managing other canine patients with malignant mast cell tumors. Introduction. Canine cutaneous mast cell tumor, MCT, is a common malignant cancer in a range of dog breeds. Emerging evidence indicates that cancer is a mitochondrial metabolic disease. Aerobic glucose fermentation, Warburg effect, linked to defective oxidative phosphorylation, OXPHOS, has been documented in canine tumors, as it has been in the majority of human cancers, regardless of histological or genetic heterogeneity. Unlike normal cells, cancer cells can grow in the absence of oxygen using glucose and glutamine as fermentable fuels. Ketogenic metabolic therapy, KMT, is a non-toxic therapeutic strategy for cancer management that restricts the availability of fermentable fuels while elevating levels of non-fermentable fatty acids and ketone bodies. Metabolism of ketone bodies in normal cells increases the redox span between mitochondrial complexes 1 and 3, thus increasing the delta G of ATP hydrolysis, while, at the same time, reducing the formation of reactive oxygen species, ROS, through the complex 2 coenzyme Q couple. It is for these reasons that ketone bodies are considered good medicine for enhancing mitochondrial energy efficiency and general physiological health. We therefore propose that ketogenic therapy might be helpful in managing canine tumors. Calorie reduction and calorie-restricted diets can also target multiple hallmarks of cancer, including angiogenesis, inflammation, edema, and tumor cell viability. In contrast to cells with normal mitochondrial OXPHOS capacity, cancer cells lack metabolic flexibility and cannot efficiently use fatty acids, ketone bodies, or other respiratory fuels for ATP synthesis. The well-documented abnormalities in mitochondrial number, structure and function compromise energy synthesis through oxphos. Ketogenic therapy used either alone or in combination with standard of care has therapeutic benefit for managing a broad range of animal and human cancers. In this report, we present evidence showing that ketogenic metabolic therapy used alone was able to resolve a malignant cutaneous mast cell tumor in a dog. Case report. A 7-year-old, 60-pound female pit bull, born in January 2004, presented in July 2011 at the Banfield Pet Hospital, Conyers, Georgia, with a cutaneous mass under the right nostril. Microscopic analysis of tissue smears revealed high cellularity with loose sheets of round to oval cells. The cells had indistinct borders and the cytoplasm contained large numbers of prominent metachromatic cytoplasmic granules. The nuclei varied mildly to moderately in size and nucleoli were rarely visible. Eosinophils were scattered frequently throughout the smear preparations. The cutaneous mass was diagnosed as mast cell tumor, but was not graded at that time. Based on clinical behavior, this tumor was likely a progressive low-grade neoplasm at the time of diagnosis. A complete blood work analysis revealed no deviations from normal ranges at the time of initial diagnosis. Although steroid medication, via prednisone, and standard of care including surgery, chemotherapy, and radiation therapy were discussed as therapeutic options, the patient's parent refused any of these treatments due to their unacceptable adverse effects. Significant adverse effects have been reported in dogs with a cutaneous tumor treated with the standard of care. 2 weeks after tumor diagnosis, the patient's diet was switched from O'Roy canned dog food to a raw vegetable diet with cooked fish and lentils. The tumor continued to grow on this diet, invading local tissues and reaching a size of about 4 centimeters, see Figure 1a. Local invasion is a hallmark of malignancy and the first step of the metastatic cascade. 2 weeks prior to the July 2013 image shown in Figure 1a, the patient's diet was switched to a calorie-restricted raw ketogenic diet. As no further diagnostic analysis was done on the tumor in 2013, it is not known if the grading of the tumor would have increased over the 2 years period, from initial diagnosis in 2011 to that shown in Figure 1a. The decision to switch the diet from raw vegetables to a raw meat, calorie-restricted ketogenic diet was based on the view that dogs evolved from wolves, which are largely carnivores, and on the general information presented in the following YouTube video. Using the dog food calculator at dogfoodadvisor.com, the patient's parent estimated that a 60 pounds, 27.3 kilograms, light-duty working dog should consume about 1,500 calories a day. Consequently, a 40% restriction of this value was used to estimate a daily caloric intake for this patient of about 900 calories a day. The new diet was formulated to contain the following ingredients: 1 organic raw chicken leg with bone, 150 calories, 26 grams of fat, 36 grams of protein. 1 organic raw chicken egg, 54 calories, 1.5 grams of fat, 6 grams of protein. 1 tablespoon, 14.3 grams, of pure Luana coconut oil. 120 calories, 14.3 grams of fat, 0 grams of protein. 3 teaspoons, 12.6 grams, of grizzly pollock oil for dogs. 120 calories, 12.6 grams of fat, 0 grams of protein. This carbohydrate-free dietary formulation produced about 444 kilocalories per meal, with a fat-to-protein ketogenic ratio of about 1.3 to 1, and was fed to the patient twice per day in the morning and in the evening at 12-hour intervals. There were no issues of compliance. As the dog enjoyed treats, 1 medium-sized raw radish, 0 protein and 0 fat, was given between each meal. The tumor gradually disappeared over a period of several months after the patient was switched to the raw meat, calorie-restricted ketogenic diet. See Figures 1b to 1d. An image of the patient's face taken in 2016 is shown here. The patient lost 2.5 kilograms, about 8% body weight, during the course of the calorie restriction and maintained an attentive and active behavior according to the parent. The patient was fed this calorie-restricted ketogenic diet until 2019. Once the tumor was no longer apparent, the patient was occasionally given cooked chicken as an alternative to raw chicken. The patient passed away at the upper age of longevity for this breed, age 15 years, in the arms of the parent, without pain, in June 2019 from failure to thrive due to an enlarged heart. No evidence of mast cell tumor recurrence was observed on the nose or anywhere else on the patient's body. It is known that overall survival for grade 2 mast cell tumors in dogs is about 21.5 months, and for grade 3 tumors it is only about 9.2 months. This patient survived for 63 months, living a normal lifespan after resolution of the cancer. A timeline of the case is shown here. Discussion. This is the first report to our knowledge of a malignant cutaneous mast cell tumor in a dog treated with ketogenic metabolic therapy, KMT, alone. It is clear from our observations that the KMT protocol used for our patient did not cause any adverse effects. No adverse effects or safety concerns were reported previously in canines treated with a ketogenic diet for managing epilepsy. The diet-linked resolution of the tumor in this canine patient could have been due in part to the restriction of glucose and to an inhibition of aerobic fermentation, Warburg effect, that is essential for the growth of most malignant tumors. A limitation of our report, however, is the absence of data collected on blood glucose, blood ketone bodies, and glucose ketone index values, GKI, in a manner similar to those collected previously in our case report of a human brain tumor patient. It is recognized that the genome of most cancer cells, including those in mast cell tumors, contain numerous types of pathological somatic mutations. Abnormalities in mitochondrial DNA and biochemistry have also been reported previously in canine cutaneous tumors. These genetic abnormalities will prevent metabolic flexibility and adaptability to nutritional stress. Adaptability to abrupt environmental change is a property of the normal genome, which was selected for in order to ensure survival under environmental stress. According to established evolutionary concepts, only cells possessing flexibility in nutrient utilization will be able to survive under nutrient stress. Environmental forcing over eons has selected for genomes that are capable of adapting to abrupt change in order to maintain metabolic homeostasis. Previous studies showed that normal dogs are remarkably adaptable to food restriction and physiological stress. The genomic defects that occur in MCT, together with mitochondrial dysfunction, will prevent the metabolic flexibility needed for rapid adaptation to nutrient stress, thus leading to tumor cell elimination through a combination of autophagy and autolytic cannibalism. The metabolically flexible normal canine cells will outcompete the mutated inflexible tumor cells for the availability of restricted nutrients, thus leading to the elimination of the tumor cells. It is therefore tempting to speculate that in contrast to the normal body cells, the neoplastic cells in the patient's mast cell tumor were unable to adapt to the nutritional stress produced from the carbohydrate-free and calorie-restricted ketogenic diet, thus causing rapid tumor resolution. Calorie restriction and restricted ketogenic diets have had success in reducing growth and metastasis in a range of malignant tumors in mice and humans. In none of these cases, however, was resolution of the tumor achieved with diet alone. Although a human glioblastoma patient has remained alive for over 8 years using a ketogenic metabolic therapy alone, no steroids, no radiation, no chemotherapy, the tumor in this patient was not resolved, but continues to grow slowly, requiring periodic debulking for continued management. Synergy between restricted ketogenic diet and glutamine-targeting drugs could also facilitate resolution of more aggressive tumors, especially for those that involve systemic metastasis and growth in the nervous system. The resolution of the mast cell tumor in this canine patient should be viewed as anecdotal until further studies are conducted in other canine patients, using a therapeutic strategy that is the same or similar to that used on our patient. By the way, the name of the dog was Minka, and she got to live to 15 years of age.